Thank you for tuning into this video explaining the 2021 Coordinated Plan. My name is Alex Gordon, and I am a transportation planner at the North Front Range Metropolitan Planning Organization. To begin, I want to explain the NFRMPO. The NFRMPO is a regional transportation planning agency covering the area of northern Colorado, roughly bounded by Fort Collins, Berthoud, LaSalle, and Eaton, an area of approximately 675 square miles. We cover two urbanized areas, the Greeley Urbanized Area and the Fort Collins Transportation Management Area. We work with the elected officials, planners, engineers, transit staff, and other stakeholders to help coordinate a regional transportation vision across 13 communities and 2 counties. The project I want to explain today is called the Coordinated Public Transit Human Services Transportation Plan, also known as the Coordinated Plan. The Coordinated Plan is updated every 4 years, acknowledging the needs of and gaps in mobility of older adults and individuals with disabilities. This plan supports the efforts of Transport, City of Loveland Transit, or COLT, and Greeley Evans Transit, or GET, which all are eligible for Federal Transit Administration, or FTA, Section 5310 funds. Enhanced mobility for older adults and individuals with disabilities. There are 3 key sections in the Coordinated Plan: an existing conditions report, evaluating the socioeconomic and ridership data, identifying gaps in transportation, and strategies to address the transportation gaps. As part of the existing conditions report, NFRMPO staff evaluated data from the 2014 to 2018 American Community Survey, or ACS, the Department of Local Affairs State Demography Office, and our own travel demand model. As you can see, the population overall in the region is expected to nearly double. The share of older adults will increase by nearly 5 points in Larimer County and 2.5 points in Weld County, respectively. We also evaluate demographic information for individuals with disabilities. In the case of the Coordinated Plan, we consider the census-defined and self-reported disabilities. There are not projections for individuals with disabilities, though a good thought exercise is considering the percentage staying consistent, but the absolute number increasing. 10% of 900,000 people is a significant number of people who may need additional assistance. In addition to looking at the socioeconomic data, we also just enjoy looking at maps. On the left are the demand response and volunteer transportation services available in our region, including Senior Alternatives in Transportation, or SAINT, Berthoud Area Transportation System, or BATS, Rural Alternative for Transportation, or RAFT, Get Call and Ride, and 60 Plus Ride. On the right are the 3 large fixed route and paratransit services available, including Transport, COLT, and GET. Not shown on either map are Z-Trip and Heart and Soul Paratransit, which both are able to transport people within either county. Throughout our outreach, we have heard of the gaps shown on the screen. Traveling around rural areas without a car can be difficult, expensive, and time-consuming if you're even picked up at all. Within the urban area, it can be difficult, expensive, and time-consuming to get between communities. In both cases, transportation affordability can be a major issue. In addition, awareness about potential services and programs can lag, which means potential funding assistance, specialized transportation, or travel training can be missed. Please feel free to reach out with other gaps that you're aware of. My contact information is available in the last slide. This is a listing of some of the questions we have asked different community groups. If you're interested in a discussion about these topics, please feel free to reach out to me. My contact information is in the last slide. So far in this presentation, we've talked about socioeconomic data, maps, and potential gaps. Now let's talk about some of the strategies that are being implemented to address those needs, especially those funded with FTA Section 5310 funds. Some example strategies include the NFRMPO's Larimer and Weld County Mobility Committees, which each meet every other month. The groups are made up of transit staff, advocates, human service agencies and providers, and the general public, and they discuss ways to create efficient, improved mobility for older adults and individuals with disabilities. Another strategy is technical assistance. The NFRMPO has successfully helped multiple human service agencies apply for grants to purchase new vehicles, expanding service and improving existing service. Transport and Colt offer a Dial-A-Taxi, offering support for Dial-A-Ride customers who need to go longer distances. The NFRMPO also creates rider's guides, which are updated periodically and posted on our website. Lastly, I want to introduce a new program being developed at the NFRMPO, the One Call, One Click Center. The One Call, One Click Center is called RideNoCo and will feature a variety of efforts to connect people to the transportation they need. In the short term, RideNoCo will develop a trip discovery tool, providing a one-stop tool to identify what transportation options exist. Because many people do not have access to high-speed internet or are more comfortable talking to a real person, staff will also be on hand to assist in this endeavor. In the longer term, RideNoCo will allow people to book and share rides. In the meantime, RideNoCo will provide training for providers and riders, as well as collect data to better identify ongoing gaps and needs. Thank you for watching this video about the coordinated plan. Please feel free to reach out with any questions, comments, or concerns to me, Alex Gordon, Transportation Planner at the North Front Range NPO, or reach out to Corey Schmidt, Mobility Manager, who can assist you with RideNoCo.